Hi everyone, today I'll tell you some common mistakes and misconceptions about melasma. Melasma is a refractory, chronic, frustrating condition to deal with. So I will tell you how you can manage melasma, how we can make it better. I'm sure you'll find a lot of tips in this video which can help you in dealing with melasma. So let's get started. First is you need to understand that there is no cure for melasma. We can only control it. Okay, a lot of patients come to me hoping that there's one magical cream that can get rid of melasma or something that they can do for maybe 1 month or 2 months and the melasma will go away forever. As somebody who suffers with melasma, I'm telling you that you need to have a very vigilant skincare routine on a daily basis and take care of your melasma every single day. Take care of certain things every single day so that it doesn't come back. It cannot be cured, we can only control it. But yes, we can control it to such an extent that it is not very visible. We can improve your melasma by 80 to even 90% depending upon the type of melasma. But you have to be very diligent with your skin treatment and very regular with your skincare routine in order to keep melasma at bay. Otherwise, it's just going to come back no matter what you do. So understanding that melasma could be there for a lifetime is very, very important so that you take certain steps and changes in your lifestyle, understanding that you need to do these steps in order to prevent the recurrence of melasma. There is nothing that can stop melasma from completely coming back, but definitely there are certain things that we can do in order to keep it under check so that they are not very visible. Second is underestimating the impact of sunscreen. Sunscreen is the most important aspect of any melasma treatment. Whatever your doctor must have prescribed, whatever they've given you, I'm sure a sunscreen would have definitely been prescribed, and that is the most important part of your skincare routine. I'm just not talking about applying sunscreen when you're outdoors. You must apply sunscreen even when you're indoors, even if you are just going to be out in the sun for 5 minutes, 10 minutes, and you feel, oh, it's morning sun, it might not exacerbate my melasma. No, you have to use a sunscreen no matter what, 12 months in a year if you want to tackle melasma. Remember that melasma does tend to exacerbate on exposure to blue light, so using a tinted sunscreen can help, especially if you are somebody with refractory melasma, resistant melasma, which is not responding to treatment. Then using a tinted sunscreen can really help in controlling it. There is no sunscreen that's best for melasma. I feel, whatever sunscreen you like to use and whatever sunscreen that you feel suits your skin is the best for you. Basically, have to use it regularly. That's more important than choosing the type of sunscreen. But if you have melasma, look for SPF 50, PA3 plus, and also it should have a tint, and it should have some physical filter, preferably zinc oxide in it. If you are somebody with sensitive skin type where you feel that whenever you walk out in the sun, skin tends to get irritated, it gets red, then it's better to use a plain mineral sunscreen. Okay, a mineral sunscreen with only zinc oxide or titanium dioxide, that is what you want to choose if you have sensitive skin. If you feel your skin can tolerate, then you can use a hybrid sunscreen, not a problem, but look for zinc oxide in your sunscreen. That can really help in reducing the recurrence of melasma. Third mistake or misconception is using over-the-counter products or just these cosmetic ingredients and thinking it will help in reducing your melasma. No, you need prescription-based creams, especially in the initial stages or if you have severe melasma. There are certain prescription-based creams which I don't want to name here because it can be misused. They have to be prescribed properly by a qualified dermatologist and it has to be used under supervision of a dermatologist. You have to use it for a stipulated period of time and use it correctly in order to reap benefits. Otherwise, it can lead to rebound darkening and make your darkening worse. Okay, so if you have melasma, please consult your dermatologist once. I'm not saying you have to go visit them every week, every few weeks. No, once you have a regular routine in place, then you can maybe visit them once every 6 months also if your melasma is under control. But that one consultation in order to understand the skin type and what your basic skincare routine should be, that is very important. Also, there are certain creams that are available that can really help in tackling melasma, especially if you're looking for control before an event, or you have to go somewhere, or you feel that your melasma has suddenly darkened. There is something definitely that we can do in order to bring it under check, and your dermatologist will be able to guide you. Fourth point is that consistency is key. It's not how expensive the products are, it's not how intensively you did the treatment, but for how long you're doing it and how routinely you're doing it. That is very important when it comes to melasma, because it is a marathon, not a sprint. You have to make sure that you follow a skincare routine that you can use for a long time, that is not very heavy on the pocket, but you can also be consistent with it. So you cannot just forget about sun protection, whether it's just for a day or just one outing. No. If it's just one day at the beach that you forget your sunscreen, no, you cannot afford to take that chance with melasma, because it is just going to come back with full force. Just one vacation is what it takes. One episode of excessive sun exposure is what it takes to take you many months back or even a year back of improvement. Okay, so please remember that using sun protection is very, very important, and consistently using it is the most important. So it's not about how intensive you are, but how consistent you are with the skincare routine, which is going to give you lasting results in melasma. Fifth is not knowing what ingredients to look for treating melasma. So ingredients are key whenever you're looking at some skincare products. Always make a habit of reading the ingredients. Even if you don't understand everything, you need to know what are the active ingredients in your serums in order to know how it works. Okay, this is very important. Otherwise, you will not know whether it's going to work on your melasma or make your melasma worse. So make sure to read the ingredients. So what do we want? We want a gentle exfoliant which can increase cell turnover, something like a glycolic acid or a lactic acid or even a mandelic acid. It has to be in a lower concentration, preferably less than 10%, so that it can help in shedding the dead skin layer. Okay, then you want an agent which can help in reducing melanin production. So you are looking at tyrosinase inhibitors, something like kojic acid, alpha arbutin, licorice extract, tranexamic acid, azelaic acid, that help in reducing the amount of melanin being produced. So this can also help in reducing melasma. Then third ingredient what you can look for is that can look for ingredients which can reduce the transfer of melanin from the cells to the keratinocytes. So from the melanocytes to the keratinocytes, the transfer should also be hampered, which is done by niacinamide. Okay, so you want to look for certain ingredients in your products, in your serum, which kind of tackle all aspects of melasma. So we want something to shed the skin, something to reduce melanin production, and also to reduce melanin distribution. So this way you are tackling each and every step of pigment production, and you'll be able to get better results. I have mentioned some creams that can be helpful in melasma in the description box below. Remember that if you have deep melasma, then it's better to consult a dermatologist and take prescription medications and use this for maintenance. But if you are somebody who is on the maintenance of melasma, then you can use one of the serums or creams that I've mentioned in the description box below. Sixth point, which a lot of people overlook, is that heat can exacerbate melasma. Okay, it's not just the sun, but even heat can exacerbate melasma. So if you are somebody who works in the kitchen for long hours and you're exposed to heat, then you want to make sure that you change that, or try to get help with certain aspects of cooking, and maybe you can just overlook everything and not stand next to the stove. That is important if you want to control your melasma. Also, using any of these masks, LED masks, could potentially exacerbate your melasma if they are emitting a lot of heat. That's why you have to use instruments that are safe for use in melasma. Okay, and also going for any kind of treatment, any deep massages that can kind of generate heat under the skin, that is something you don't want to do if you have melasma. If you are somebody who works in the kitchen for long hours, then sucking on small ice cubes can really be helpful. This is a tip that I heard from Dr. Dre, who is one of my favorite YouTubers. She is a dermatologist who mentioned this in one of her videos, and I thought that this is really good advice, and I do tell it to my patients as well, to suckle on a small ice cube if they are working in the kitchen or in a very heated environment for a long period of time. Seventh misconception is that you need a lot of products in order to control melasma. Absolutely not. To be very cautious about what products you use in your skincare routine. You want them to be gentle and effective. You don't want them to be very irritating. So I usually prefer a very gentle, mild cleanser. You can skip the cleanser in the morning time, but a cleanser is a must at night time. Then follow it up with a serum. That serum should also contain ingredients at a lower concentration initially, which cannot irritate your skin too much. Okay, so anything that irritates, burns, or stings your skin can worsen melasma. So be careful whenever you're using ingredients on your skin. Remember to not overdo exfoliation. You know, a lot of people like to use this AHA BHA peels on the face and cause visible peeling. But with that, if you're not using proper moisturizers and practicing sun protection, then it's just going to make your melasma worse. So always remember to use very gentle products on your skin which do not irritate your skin, because that can exacerbate melasma. One very important cause for melasma is hormonal pills. Okay, so if you're on any kind of OCPs, oral contraceptive pills, or you have a hormonal intrauterine device inserted, then you want to consult your healthcare provider for any kind of alternate options, as this could be exacerbating your melasma. So if you're on any OC pills, please consult your gynecologist for any substitute, as that could be a reason for worsening of your melasma. Ninth point is that the course of melasma is very difficult to predict. Okay, a lot of patients come to me with very tiny specks of melasma and they ask me, is it going to get as bad as my mother's? My aunt has it. Is it going to get as bad as that? It's extremely difficult to predict. As someone, or on the contrary, you know, somebody who has a lot of melasma and who feels that their mother or their aunt recovered after menopause, and will they also recover? Will they also have lightening over time? Very, very tough to answer these questions. Okay, because the course is extremely difficult to predict. As again, as someone with melasma, I know how frustrating this can be, but sometimes you just have to trust the process and be very regular with skincare and be diligent with your routine. Stick to it, be consistent. That's the only thing that we can do. There is no way to predict whether it's going to spread, whether it's going to reduce after menopause, whether it's going to flare up during pregnancy, whether it's going to go away completely after pregnancy. All these questions are difficult to answer because it's different in different people. The course is completely different, but all we can do is be consistent with treatment and practice sun protection in order to reduce the recurrence. 10th point, it's the last but not the least, is that lasers are not the answer. Okay, a lot of people feel that if they go for some treatment, maybe it's a chemical peel or some lasers, microneedling devices, microneedling RF devices, that can get rid of their melasma. No, I usually only do devices in patients who have resistant melasma, who have not responded to topical treatment, because topical treatment, regular skincare, and sun protection is always my number one choice of treatment. Okay, so sometimes Q-switch Nd:YAG laser can actually end up worsening your melasma. See, all these lasers do generate a little bit of heat, and that could be worsening your melasma. So you don't want to go ahead and do these treatments, especially not by somebody unqualified. If you do want to get procedures done, please always consult a qualified dermatologist who has enough experience in treating melasma, because you don't want to worsen it. So I would suggest that keep chemical peels only, as a backup plan. After, if you feel that you're following a skincare routine but you want a little bit of boost, then yes, there are certain peels that can help in reducing melasma, but that is not something that can rescue you, that can cure your skin, or that can take away the hazard of having to use skincare every day. Okay, nothing can replace it. So you have to practice diligent sun protection in order to control your melasma, and make sure that you do it regularly and understand your skin, understand its requirements, so that you can take good care of your skin and that melasma can be controlled. So melasma is a difficult condition to treat. As a patient and as a dermatologist, I am faced with lots of challenges when I encounter a patient of melasma. It's always difficult. Every patient is different, and we just need to formulate a proper skincare routine in order to control it. So remember, controlling it and not curing it is the answer. I hope you found this video useful. If you like skin and hair related content, you can follow me on my Instagram handle, Dr. Achal MD, where I post that skin and hair related content daily. Thank you for watching.